Hello, everyone. Welcome to our second MindWise learning session. Thank you for joining us today. Really delighted to bring you this conversation with four remarkable, accomplished individuals. I'm Lisa Desai, Chief Behavioral Health Officer at MindWise Innovations. And as you know, we are committed to mental health education, suicide prevention across communities, schools, and workplaces. So without further ado, again, welcome to our conversation addressing mental health and suicide prevention with collegiate athletes. And I would like to take a few moments to introduce our panelists. I will go alphabetically, beginning with Kate Bergstrom. Kate recently joined Boston University as Senior Associate Director of Athletics. Hi, Kate. Prior to BU, Kate served as the Executive Associate Commissioner for the America East Conference, an athletic conference of Division I schools and universities in the Northeast region. There she spent more than 8 years in various capacities, but most recently as Chief of Staff with oversight of finances, HR, and general business operations. Two aspects that she was keenly involved in were the conference's leadership initiatives, including Spread Respect, which dealt with diversity, equity, inclusion, belonging, and health, safety, and well-being, which included mental health, sports performance, and sports medicine. Kate has been a tireless advocate of student-athlete mental health and has a passion about behavioral health, both professionally and personally. I can attest for her true work and commitment to not only addressing mental health with student athletes, but staff and coaches as well. So thank you, Kate, for being here. Linda Flanagan is an author, freelance journalist, researcher, and former cross-country and track coach. Linda is a graduate of Lehigh University and the Fletcher School of Law and Diplomacy and was an analyst for the National Security Program at Harvard University. She is a founding board member of the New York City chapter of the Positive Coaching Alliance and an advisory member of the Aspen Institute's Reimagining School Sports Initiative. Her writing has appeared in The Atlantic, Runner's World, and on NPR's education site, Mind Shift, where she's a regular contributor. Her recent book, Take Back the Game, How Money and Mania Are Ruining Kids' Sports and Why It Matters, is an insightful look at the way youth sports has evolved. And I can tell you it is incredibly eye-opening. Linda's a mother of 3, a lifelong athlete. So welcome, Linda, wonderful to have you today.
Nice to be here.
Dr. Caitlin Gallo is a clinical psychologist licensed in Massachusetts and New York. She is a founding chief clinical health officer at Christie Campus Health, a company that worked to improve mental health and well-being of college students. She currently has a private practice where she focuses on treatment of anxiety and OCD in young adults, and has extensive experience in her clinical work treating student athletes. She completed her undergraduate degree at Harvard University and has a doctoral degree in psychology from Boston University. So thank you very much, Dr. Gallo, and I believe you said it's fine to call you Caitlin for purposes of this conversation. So thank you. And finally, last but never least, John Troutwine, founder of the Will to Live Foundation. John is the Chief Customer Officer of Source Support Services, a global IT company. In October of 2010, John and his family suffered a tragic loss of their oldest son at the age of 15, Will, who is a high school student who died by suicide. His death was devastating, not only for the family, but for the community as well. As a result, John, his wife, and his wife, family members, and close friends formed the Will to Live Foundation, which works closely with youth in communities across the U.S. to raise awareness about teen suicide. The Will to Live Foundation has raised over $1 million, much by kids, youth involved in these efforts, to increase awareness, education, and deliver hope for teens to each other. Their efforts have funded many programs, among of which are our own Signs of Suicide, which are in schools across the country. John is a graduate of Northwestern University and an ex-professional baseball player, playing 7 years in the Expos and with the Red Sox. So, John, thank you for being here. You bring a very unique perspective as a pro athlete, ex-pro athlete, and a parent.
Thank you, Lisa. Good to be here.
So I would love to kick this off, and we're hoping this will be very conversational, with a question for each of you. If each of you could speak for a couple of minutes about what brings you to do this work. Kate, if we could start with you.
Lisa, of course, and thanks for being here, and thanks to the MindWise and Riverside Trauma team to putting this together. So as Lisa mentioned in the intros, I have been working in collegiate athletics now for quite some time. And for me, I have always had a passion around student athlete well-being and mental health. I was a student athlete myself, and over many years of being around sport and sort of seeing the challenges that age demographic we're facing in particular. Oftentimes they are high achieving individuals. They're coming out of high school and they've had straight A's, they've been the top of every team, they've been the captain, they've been this, and then they go into a new environment, and just like any student, have major adjustments. And so I've been very passionate about bringing together strategy and attention to helping them navigate those different challenges. I think for at least, one of the things that's not only drawn me to the work, but also kept me in it, is watching the potential. Like student athletes have a tendency to be leaders. We want to not only create an atmosphere where their leadership is harnessed to create change for the people around them, their peers, their teammates. And so I've really enjoyed trying to just keep improving that experience and watching them want to improve that experience and create sort of a system of well-being around them. I've seen it in real time happen and save lives and change outcomes. And so for me, it just keeps at the forefront of what I always want to be doing when I'm doing my day-to-day work.
Thank you, Kate. And I know that you're incredibly excited to be in a role where you're interacting so much more directly with student athletes now. Thank you for that. Melinda, can you talk a bit about what brings you to this?
Well, let's see. As you mentioned in the introduction, I'm an author of a book on youth sports, and that introduced me to a lot of the concepts we're talking about, not only youth, but a collegiate level, and they're very related. And what I wrote the book because I'm a journalist and had been exploring the subject in that capacity because essentially what I saw as a coach, I was a coach, a high school running coach for 17 years. And I was very bothered by what I saw and experienced. And I'm also an athlete myself, and I have kids, one who played a lot of sports. So just being immersed in this universe of competitive sports, starting at a young age and extending into college, kind of motivated me to explore the subject. And, there's just a lot of troubling information. The deeper you dig, the more troubling information you find. And, it's not only at college, it's at the youth level as well. And that's why I'm here.
Wonderful. Thank you. Thank you. And I know we'll hear more about your perspective and what you've learned from the book and from your experiences. Caitlin.
Thank you, Lisa. So as you mentioned, I'm a clinical psychologist by training, and in my practice, I treat young people, including college athletes. And so I get to see firsthand a lot of what they're dealing with. And I also recently spent several years as the chief clinical officer of Christie Campus Health, which was a college mental health company. So between my clinical work and as a psychologist and my role at Christie Campus Health, I've really been professionally immersed in the mental health needs of young people for many years at this point. Even before I became a psychologist, though, starting when I was an undergraduate, I was a peer counselor. So I supported my fellow students who were dealing with mental health concerns. Then when I was a graduate student, I was a resident advisor on a college campus for several years, specifically in a first year dorm, so all freshman students. And at that time, I had the opportunity to support a number of student athletes dealing with mental health concerns. Some of those issues were very closely related to their role as a student athlete, like, for example, a career-ending injury that then led to a bout of depression, or eating disorder in the context of trying to maintain a low body weight to try to improve athletic performance, or another student who, as was already being mentioned, went from being the best high school athlete in her area to a college player who wasn't really seeing any game time. So that led to a lot of questions about her identity. And now in my clinical practice, I see both issues that are directly related to being a student athlete, but also some in-student athletes that are not so obviously related to being a student athlete, but the fact that the individuals are student athletes can't be separated from what they're dealing with. And the stress of being an athlete at a high level with having a mental health condition can certainly take a big toll. So for example, I think about a student who I've treated who has significant OCD symptoms that takes up a lot of time, right? Extra time is not something that student athletes really have in their schedule. Other students with generalized anxiety disorder or perfectionism, staying up really late, then they have to get up. Their roommates might sleep until 10 because they don't have an 11 o'clock class, but they have an early morning lift, so they're not getting enough sleep. So all of these things really bring to the forefront of my mind how really specific of an experience student athletes have and how important it is to really take into account that specific experience when planning for their mental health needs. And unfortunately, on a personal note, I've also lost a close friend who was a college athlete, as well as a number of relatives to suicide. So this work is very important to me on a personal level as well as a professional level. And I'm really grateful both to the panelists and also everyone who's attending today to try to learn more.
Thank you. Thank you, Caitlin. And that's such an important reminder that we're all 1 degree away from knowing someone that's died by suicide. And so it's also a reminder to me to let all of you know that this is, we always say at MindWise when we're having these conversations and trainings or webinars, that suicide is a topic that can hit some of us very hard. So at any point during this conversation, if you'd like to step away, take care of yourself, please do so. Highly encourage that. And John, clearly you have the most personal reason to get involved in suicide prevention. Would love to hear from you. about getting started in this work?
Sure, Lisa. First of all, great to be here and honored to be part of this esteemed panel. My story is slightly different, right? I'm here as a dad. And the two main reasons why I was so interested in joining this group today was, 13 and a half years ago, if I was invited to a program like this, I would have politely declined because suicide wasn't something in my vocabulary. Mental illness wasn't something that anyone in my family would ever have. We're the Troutwines. We're fine. But I learned the hard way that mental illness is everywhere and it is maskable. And 13 years ago, when I lost my son, I was devastated because I was so unaware and so uneducated about mental illness. And so was my family, and so was my son. And I said, I've got to find a way to use this platform of the foundation that we started to raise awareness to other parents and other families and other coaches and other trusted adults in the lives of our kids today, that they really do have it very hard. They have it harder than I did when I was their age. And sometimes that's hard to believe when you see all these wonderful opportunities. But the fact that I didn't have this enables me to win every argument I ever have about it. It is hard today to be a student and to be a student athlete. And I just wanted other parents to be aware, something that I wasn't. And then at the same time, what I experienced as a father who lost his firstborn child, his perfect, popular, successful son, to mental illness, was the power that my friends and that my teammates had to pick me up and lift me up through life's darkest days. And at Will's funeral, when I was giving the eulogy here in Atlanta, I'm from Chicago and we live in Atlanta now, I started picking out teammates of mine from as far back as Little League, let alone middle school and high school and college and professional ball. They were teammates, had come from all over the country in a couple days' notice to be there for me. And these friends of mine, these teammates were my life friends. These were the ones that I shared all my first with. They went through all the challenges together with me. They understood me, and they had this ability to lift me up and truly deliver hope to me. And as the foundation began, we started working with kids. We started to realize that these friends that I met when I was a teenager. I met when I was on a team. And the power that a teammate has to show true understanding to his friends who are struggling is unmatched. Who best understands what it's like to be a junior or a senior in college today, being a student athlete, trying to make the varsity team or keep their spot on the varsity team, maybe go play pro ball or not, maybe go find a job or start interviewing process where the world is smaller, the world is more competitive, and everything is just more of a challenge. Well, who best understands that? A 60-year-old father who went through all of that 40 years ago in a much different world? Their coach, their mom, their dad, their teachers? No, it's their teammates, because they're going through the exact same challenges. So that peer-to-peer relationship part really hit me hard. And we came up with this concept of life teammates, and who are your life teammates, and do they know? And if you have that kind of conversation and you create this culture where it is okay to not be okay with your friends and with your teammates, then the conversation is easier to begin. My son Will never told anyone he was struggling. He was the leader, he was popular, he was a very successful student, athlete, musician, etc. But he didn't know what he had. And he didn't think it was okay to not be okay, because he lived in a culture that I helped create, where of course you're okay. Isn't this wonderful? Right? So I think that's why the two reasons. One is just raising the awareness of mental illness in our society is so key. But then two, understanding the power that we have to deliver hope to each other by showing understanding and creating this culture where it's okay to talk about something that has such a strong stigma, which I'm sure we'll talk more about later today.
Thank you, John. You've touched upon culture and peer support, being there for one another's peers. and stigma. So absolutely, we'll dive into that. And I'm just going to kind of ask one of you, maybe Linda, to kind of talk a little bit about this, and then just kind of pass it off among yourselves. There's so much that we know now about athletics. The NCAA has been tracking mental health among athletes and coaches. We're focused on student athletes today. So we know since the pandemic, like the universe, anxiety, depression, mental stress, mental exhaustion increased. Some positive news that's continuing, unfortunately, at higher levels. Some positive news is hopefulness is also increasing among college athletes. Positivity and some degree of faith that they can balance life is increasing slightly. So much more is coming to the forefront around student athletes. So Linda, if you want to kick it off with what has been most salient for you and what we're learning.
Well, I think what everyone who's trying to help student athletes needs to know, if they don't have prior knowledge, is that the starting point for them is they're physically and mentally exhausted. They have basically 2 full-time jobs. And again, it's very different from if any of us played sports in college. It's very different. At Division I level, they spend 33 hours a week on their sport and 35 in school. Division III, which is supposedly easier, 28 hours on their sport, 40 on their academics. So you have kids who are really, the stress from that alone, having 2 jobs. And on top of that, the same NCAA study found that they get, at the Division I level, 6 hours and 15 minutes of sleep a night on average. So that gives a context for, you're dealing with young people who are exhausted. This, which I think is really important for the conversation. And also more recently, while there, as you pointed out, Lisa, there have been some, they're really making efforts at the college level to address this, because, a lot of coaches are talking about it. Some survey I read said 80% of coaches talk about mental health all the time. Be that as it may, there's an enormous gap, particularly between men and women. In December of last year, the NCAA put out the survey results of 23,000 student athletes. And the most shocking finding, you can find it if you Google it, the gap between men and women is so wide and stark, to the point where 44% of women felt overwhelmed by all they had to do. 17% of men did. 35% of women felt mentally exhausted, and 16% of men did. It's just very stark across the board. Women are struggling. So I think this is something we all have to acknowledge and deal with, on top of the sleep and exhaustion, and the fact that the stakes are just a lot higher for everybody.
And I'll jump in, Lisa, if that's okay.
Oh, yeah.
And what Linda mentioned about sleep, I certainly want to double click into at some point in the course of this webinar, because I think it's a really important topic. And since I've been here at BU, we talk a lot about sleep and track sleep and all of that. And what Linda said is a big problem in terms of how it's impacting well-being. But related to some of the work with the NCAA, Lisa, I wanted to make mention, the NCAA is about to release a new version, updated version of mental health best practices that's due to come this month in February. And it's been interesting because my colleagues, there were a lot of really strong directives, using the data some of the data that Linda had mentioned, about disparities between female student athletes and male student athletes, and also just coach ability. There's been they've done an exceptional job combing through the data. What I've found most interesting, and while the best practices aren't out yet, there's been some at least high level, peeling of the curtain on what's to come. A lot of the focus has been around identity. So understanding what a student athlete identity is. I think sometimes, and I do this, and I have to check myself constantly, is we forget that athletes are students. Then we also forget that athletes and students are humans, and they have human problems just like we do. And so we'll see what comes from there in terms of recommendations. But I think the 5 of us looking at each other here know that the intersection of identity is such a big part of an 18 to 22-year-old's development. And so I'm really looking forward to sort of how that NCA resource pushes myself and our colleagues to think more about how sexual identity interacts with mental well-being, how gender identity interacts with mental well-being, and different cultural factors that make us all unique. So I just wanted to put that out there. I think for me, those are some of the things that I'm glad that narrative is shifting. And we're talking more about the human element of existence in how we address our student athlete needs and concerns. Because while a lot of the problem, like Linda mentioned, is they're working 2 full jobs and they're doing this, but I think the things that, at least anecdotally, sometimes the feedback is it's not actually about the sport sometimes, and it's not actually about the student sometimes, it's about the human. It's my significant other just called and that tipped me over the edge, and now I feel I'm in a panic and all those things. So I think talking about, or my family is not accepting who I am from a gender perspective or a sexuality perspective. And so I think reframing the conversation is thinking about this population, which we put on such a pedestal for many reasons, and they deserve it, is also human. And so I'm looking forward to us kind of, getting into that conversation as a next development of college athletics.
I love that concept of being human, right? And what really jumped out at me is all of these athletes that we're talking about, and every single person on this call, right? 1 in 5 of us are suffering from some form of diagnosable mental illness. That's a fact. 1 in 5. I had no idea. 1 in 5 of everybody I've ever met. 1 in 5 of the people in my company here, right? And so it is very, very common. And that can actually be a positive thing. You are one of millions. You're not one in a million. And so this concept that it is everywhere, it is treatable and beatable, but it is also extremely difficult with a terrible stigma. But that human part goes beyond just me as an athlete and the 2 jobs, as Linda said, which is so true. But what about my family? 1 in 5 of my family members are ill, right? And so there's so much going on no one can truly understand the chaos that is going on in another person's mind. And as a student athlete, you're supposed to be strong. You're seen as a stronger person, right? And it just makes it even harder to talk about it. So there are so many things, potential things going on in all of these athletes' lives. And if we just know that, and we show that we know it, we can create this culture where it's okay to actually talk about it. Yeah. And talking about it isn't going to bring shame or show weakness or something like that. It's actually a very positive thing, which we are seeing more and more of today. But the statistics are still there. It's affecting not only the athletes themselves, but the people in their lives. It's their loved ones. And that can also really add to the difficulties that they go in their day-to-day job, or day-to-day double jobs, if you will.
Absolutely. And Caitlin, that is such a segue to your work, and curious to hear what trends, what you're seeing in terms of mental health clinical presentations that are happening with student athletes that are unique, and what are the unique risk factors, protective factors. The other thing also, before I turn over to you, Caitlin, just to mention is, John, you've talked about mental illness, and there certainly can be an overlap between depression, mental illness, and diagnosed mental health conditions and suicide. What's also, as we all know, is so complicated about suicide is there may not be a diagnosed mental health condition, and a person may still be suicidal or die by suicide. So I think that's why these conversations are so important, because it's a very just multifaceted situation. Caitlin.
Yes, that's exactly right. And, to the points that have been made around, student athletes, our students, they're human beings. That's very important to keep in mind. And there are actually not a lot of data that explicitly compare mental health conditions in student athletes to non-athletes in terms of, say, specific rates or specific diagnoses. And a lot of the research that is out there shows that they're largely, as you might expect, the diagnosable conditions are similar, regardless of whether you're an athlete or a non-athlete. The presentation of it might be different. There are some risk factors that might make a student athlete more likely to have a certain mental health condition, but there are also protective factors as well, as you mentioned, Lisa. So there are some important differences, even though the diagnoses might be largely the same. It's similar to their non-athlete peers. Mental health concerns, as Linda was stating, are highest in women, also students of color, student athletes who identify as queer, or those who have difficult financial situations. Those people have a higher likelihood of being diagnosed with a mental health condition. And unfortunately, the pandemic exacerbated a trend that had been happening for some time. But since the pandemic, in some of the NCAA data, there's, as was mentioned earlier, high levels of mental exhaustion, but also anxiety and depression in student athletes as compared to before the pandemic. Now, what are the stressors? Interestingly, a lot of the stressors are related to, as the survey stated, academics, the future, and financial stress. So those are the top 3 stressors that student athletes that are hard for them to handle. So of course, there's stress related to participation in their sport, and academic stress probably gets worse if you are also doing something else for 30 hours a week, and it's hard for you to have enough time to write the paper in the way that you might like or prepare for your exam. But those are the things that student athletes are reporting are making them experience the most stress. There is some evidence that college athletes are at risk for things like clinical or even subclinical eating disorders as related to their sport, substance misuse, sleep problems, mood disorders, and also gambling addictions, which is, it's sort of a new area of research in mental health, but is becoming more of an issue as sports gambling is becoming a little bit more mainstream. We know that stress, so wherever the stress is coming from, especially if the stress feels unrelenting or overwhelming, can have a negative effect on mental health. We know, as everyone's been saying, unfortunately, stress can be a big part of life for college athletes, and the vast majority of college athletes report feeling some amount of overwhelming stress at one point or another. Again, though, what are they feeling stress about? Their responsibilities, their romantic relationships. In one study was shown that that's something that leads them to experience a lot of stress, and sleep. As compared to their peers who are not athletes, they're more likely to experience sleep difficulties. And a lot of that is related to just literally the number of hours in the day. When you add everything up, if they want to do anything else outside of their school and their sports, then things start chipping away at sleep, whether that's, going out on a weeknight to celebrate a roommate's birthday, or participating in an additional club or activity, something that interests them. They're having to make these hard choices. And unfortunately, sleep often is what falls by the wayside. So when it comes to risk factors specifically for suicide, student athletes, again, face similar risk factors as people who are not student athletes. So having had a family history of suicide might make it more likely. A previous suicide attempt might make it more likely that a suicide can occur. Having a diagnosis of a mental illness or a significant physical illness, having a history of trauma, experiencing a big loss. So that could be experiencing the death of someone close to you. It could be an end of a relationship. It could be changing of a status in your sport, right? You're on a team and then you're not on a team, or you're on a team and then you have to take a lot of time off. Facing oppression or injustice, using substances or other addictions like gambling, or not having access to support services. So all of those things, this is at a very high level, right? So there are instances of suicides where none of these things were in place, but when you look at the big picture, these factors might make it more likely that a suicide can occur. But there are also some protective factors. So having a sense of purpose and hope, which of course, as part of a team, that can be something that that students can really play a part in. Having coping skills, learning coping skills, and then being able to use those coping skills and problem solving skills, having social support, and also being and feeling able to express emotions. So if you know, to the point that's been made a few times already, if it's okay to express emotions that are not some of the, you know, the quote, I put that in quotes because no emotions are good or bad. They're all just emotions, but there are some that are more socially acceptable to express than others. So if you're able to express the range of emotions, having access to good behavioral health care, asking for help, having strong faith or values, whether they're religiously affiliated or not, other values that can in some situations protect against suicide, and also very tactically limiting access to ways to attempt suicide can also help to protect against actual suicide attempts. So, you know, again, these are all very high level, but as you're thinking about individual students who you might have in mind, these are things to both in terms of risk factors, but also protective factors. These are things to keep in mind, right? Is there a student who has just experienced a loss? Is there a student who seems to be going down a path of misusing substances? Is this a student who has a lot of social supports, and we can, you know, as a clinician, I would think about, okay, how do I help this student access their social supports, be more connected with others? So these are just kind of all things to keep in mind as you're thinking about working with student athletes individually, but also as a group.
And I appreciate, thank you, Caitlin. I appreciate also that you mentioned what we sometimes overlook when we think about athletes in terms of substance use, because we think of them as fit and very focused on being physically healthy. And so that can sometimes, the risk for addiction can get overlooked. Curious what others of you think has not been, what would you like to shine a spotlight on that's been overlooked? Linda, I saw you unmute.
Oh, yes. Well, one we haven't talked about, it's been alluded to, is the effect of injuries. Injuries are devastating to athletes. I mean, especially if you've been playing your whole life and now suddenly you tear your ACL and you're on the bench for 9 months. I mean, that's a huge problem for athletes. The other is the fact that, and I think many like high school kids going into college don't appreciate how much their lives are going to be circumscribed by the team, the coach, the expectations. I mean, they're basically indentured servants, and their lives are controlled by their coaches. So and not to say coaches are mean or something, but they have to adhere to the schedule. So they can't go home. You know, a lot of freshmen are homesick, and, you know, they can't go home on a weekend. They have shorter vacations. The seasons have expanded so that, you know, no athlete just has 3 seasons anymore. The whole athletic experience has been ramped up. So it's just a bigger commitment all around. And that's going to be hard if you're struggling.
Yeah. And, you know, a project that Kate, you're very familiar with America East. I was really struck by the fact that student athletes are often back on campus the day after Christmas, and no one else is back on campus. And it's a dark, cold campus oftentimes, and they're the only ones there. So, Kate.
Yeah, I can certainly speak on that. The terminology that sort of we use in this landscape is like time demands, to sort of articulate exactly the level of obligation, you know, that a student athlete is having to a program. And what Linda said is absolutely true. And those events can create isolation for student athletes, whereas, you know, they're here on campus because they're playing over Thanksgiving and it's the Friday, and so they don't get the chance to go back. They see on social media, which, as John pointed out, everyone's got one of these. This didn't always exist, that their friends from high school are home with their families, and you know, sort of that cycle begins. So the time demands is very real. There's also, and for those that are tracking college sports closely, time demands are only going to get worse as we have Stanford and Cal joining the ACC, and now the student athletes to play one basketball game or two basketball games are going to be flying 6-hour cross country trips. I am from California and live in Massachusetts. I don't like doing it twice a year. So doing it on a weekly basis while you're also, taking a full course load and practicing and all of that is no joke, going to create some challenges. We talked about sleep and all those things. One other thing sort of in kind of the unique factor lens, Lisa, that I just want to mention, and I think gets overlooked. And I know, John, you've talked a little bit about weakness, and maybe you can take this road as well, but is this concept of mental toughness. There's really no other 18, maybe branches in the military, but 18 to 22-year-olds that are being told that, like, an injury is a state of weakness. And these are coaches that have hopefully are phasing out and more of an old school mindset, but that there is a constant fear of being perceived as weak or being able to not meet the expectation or the level of demand, whether that's through a fitness test, or not being able to balance a variant, or feeling off one day or feeling sluggish. And so I think what ends up happening then is a student athlete may go inward because they don't want their coach to think that they can't handle it. So if they say, hey, I need to leave early, or I just need one day off, or I need to skip 6 a.m. lift because I'm not sleeping, they're going to be potentially worried that on the backside of that, they're not going to receive playing time or going to be perceived differently. So there's sort of fear-mongering kind of culture that has existed for decades and decades in college athletics. I'd like to think, and I know the coaches that I'm working with here at BU are very different than that. And we hire and try to retain coaches that understand that students are humans. But that mental toughness and the sort of perceived weakness is something that I know is special, a special challenge for our student athletes.
It's this whole stigma that is so powerful with mental illness that doesn't exist with other illnesses, just make it so much more difficult to want to expose yourself, right? And Kate, you're spot on, right? I mean, the student athletes are supposed to be strong, and the instant you have a mental issue, there's this fear that it's a character flaw, that it truly is a weakness, and it might cause a coach to think twice. It's the championship game and he's not quite all there because he has this, right? It's a misunderstanding. Just because they have the issue, or they have the problem and depression, doesn't mean they can't do it. So there's really more proactive ways to address the fact that every coach listening, you have players that are struggling. You do. It's common. It's perfectly okay. So create this culture where it is okay. There is understanding. And don't forget that the power of the teammates have. So encourage teammate meetings. Encourage that day after Christmas, have the team get together and talk about their Christmas and what was good and what was bad. And we're in this together, guys, right? And and gals, it's so important to promote this concept of the power that the teammates have. A compliment from a teammate is always going to mean more than a compliment from a coach. And I think that's something that's really important for coaches and trusted adults and teachers to understand, that these kids do have the power to give each other understanding, which then gives each other the comfort to talk about something that has such a strong stigma. When Robin Williams died, I got interviewed, and the interviewer said to me, how could he, a man who had everything, do such a cowardly thing?
Oh my goodness.
And my response was, I know. How could George Harrison, who had everything, the Beatles, how could he die of cancer? What a coward. And the interviewer looked at me like I was nuts. I said, it's an illness. He has an illness. And we need to treating it like an illness, and an illness that doesn't get treated, an illness that doesn't get talked about can lead to a tragedy. And that's a really doom and gloom approach. But I guess my point is, these these teammates have the power to improve each other's will to live and show that it is okay to not be okay. I'm just like so many other people. I don't have this character flaw. It's not a choice that these guys suffer from. I will say this, it's very difficult. Championship game coach and your best player comes up to you, that's hard as a coach, right? And so it's not an easy thing here. This is what makes this mental illness so difficult across the board. But my point is just being aware and showing understanding that it is difficult, but let's find a way to improve you so that you can play tonight, because you know we have a plan to get you help tomorrow. Something to that effect, I think, is really a very positive and powerful way to approach these things.
Yeah, and I think very much you're introducing our next topic, which is culture, John, and how the culture of the team, the culture of the athletic department plays such a big role, and normalizing the conversation, which is so important across the board in mental health. So when we think about, I wonder, Linda, if you could spend a little time talking about this, since this is so much of what you write about, is how has the culture of athletics evolved in positive and maybe not positive ways? And I know you talk about the myth of culture building through kind of the adversity of sports, but wherever you want to take this that you feel
Sure,
like
sure.
is relevant.
Yeah, well, and as I said, when I started it, when I wrote the book and started exploring this stuff, I was looking at youth sports, but it is so connected to college sports. They're inextricably linked. And I was very curious to find out what had changed, because, I ran in college, there could be, I cannot imagine it being any more different than it is for the young people who go to college now. So I was like, what has changed? And so I identified three main reasons that have us where we are. And the first is that youth sports and college sports, they're a big business. There's a lot of money changing hands. Their industry is both pushing demand and responding to demand. It's, yin yang. And that has changed. That's a function of, for a variety of reasons, decline in public spending being one of them. But it's a big business. So that's one. The second is, which is to me the most interesting, is the changed attitude parents have towards children. And again, we can always look back and say, it wasn't like that when I was growing up, and that's evergreen. But some of the big changes involve like the size of families. So we've gone from typically a family of 4 kids, now it's a family of 2 kids. So children are more precious. They're more scarce, so they're more precious. There's tremendous economic anxiety and researchers attributed, say the 70s is when this really began, when we had such bad inflation, but it's continued. Just the other day in the Times, there was a story saying 80% of parents feel great anxiety about their kids' economic prospects. Everyone's nervous. And the third is stranger danger. We have this exaggerated fear of, there's a horror around the corner, and so we need to have our kids constantly supervised. And all of this has changed the way parents interact with their kids, and kind of have changed what they expect from their kids, and engaged in concerted cultivation is the term that sociologist Annette Leroux came up with to describe what parents do to get their kids prepared. So all of this, that really contributes to the stakes being higher. And the third cause, so it's money, the changed parental attitudes, and the third is changes at colleges. I'm sure, Kate, you could speak to this, but even if you take sports out of it, everyone knows college is prohibitively expensive. For many families, it's more than their mortgage. It appears to be more competitive, much tougher to get into. That's the perception. Whether that's the reality is another thing. But all kinds of changes at colleges, and also colleges are not clear about what they're looking for. So it's expensive, they're hard to get into, but no one really knows. And yet then there's this sports, and there's the understanding, I think it's quite well understood, especially after Varsity Blues, that sports can give you a way in. At some schools, there's $3.6 billion in scholarship money. There's generally held to a lower academic standard. They have streamlined admissions. So there's this carrot out there that makes college sports more attractive. And You know, one of my colleague and friend, Rick Eckstein, who's a professor at Villanova, said college recruitment takes place almost exclusively through a pay-to-play pipeline. So many kids have, the majority of kids who are playing college sports have been playing them a long time at a high level. So by the time they arrive at your doorstep, Kate, many of them are just used up. And I think that's like a really important, it's not like when I think about when I went to college and ran, I hadn't run in high school. So I wasn't used up, I was fresh. So many of the kids now are like the stakes, it feels so intense, so important. Now here they are and they have to double down even more.
And, you know, Linda, when I hear you talking about this as a parent, I have such empathy for the parents. All I keep thinking, though, is everything you've said puts more pressure on the student athlete. And so from childhood through high school, going into college, they're already walking in with that pressure. So thank you for that perspective. I find it fascinating. And so now we're talking about, so how do you support, kind of begin to change the framework a little bit and create a more supportive atmosphere? Kate, I know have become very familiar with psychological safety, the idea that, you know, let's build a culture that feels based on trust, make mistakes, not punitive response, kind of problem solving. Can you talk a bit about what you've seen, maybe some examples of programs, you know, that has kind of tried to build that?
Yep, absolutely. And one thing too, Linda's, again, I think I've said this 3 times already, Linda's absolutely correct. In everything she said, and you know, sort of early sports specialization and all this stuff, we see that when sometimes student athletes get on campus and, you know, it was a heavy part of their high school years, and now it's really like a full-time job in some ways, that, yeah, there's even quicker burnout. And so how do we create structures and systems for them to figure out how to get resources? And so, Lisa, to your question, we obviously at America East, in my previous role, we spent a lot of time working with coaches, launched an entire sort of, you know, attempt to have a proactive educational push for them, knowing that they were responsible for setting team culture in an attempt to prevent suicide and other catastrophic situations within teams, and trying to build positive team culture. And so Lisa and her team and myself and our team at America East spent a lot of times with our 9 different universities to try to educate around psychological safety. And I've seen that now play out, both in coaches that have been successful with it, and I'll talk a little bit about that, but then also in things that have been harder and where it just doesn't seem to be clicking, and what happens when a coach can't create an environment of psychological safety. And just to sort of zoom out for a second, the way, at least, you know, we talk about psychological safety through athletics is, you know, obviously it was a concept that was created at Google, but the MindWise team has done a great job adapting it for sort of the athletics and college athletics mind lens. But it is really sort of like getting our student athletes to feel like they can fail, and it's okay to fail. They can ask questions. They can have hard days. They can have good days. They can talk to their coaches about issues. We want to create trust. We want to create transparency. And in doing so, we will, one, perform better, which at the end of the day, a coach's contract is often based on performance. And when you're putting that in the hands of 18 to 22-year-olds, there's inherent challenges with that. And so if you can create a culture where performance isn't just based on how hard you're practicing and how many reps you're doing in the weight room, but is around the culture of the team that you're building and giving them the chance to feel safe in that environment so that they perform better, they get ahead of issues, they're more proactive in managing their own well-being, and then ultimately you have healthier student athletes, happier student athletes, and student athletes who want to work harder for you. So I remember when Lisa and I were first talking about the programming a couple of years ago, you know, sometimes you lose a coach by just talking about what they feel like might be fluff, you know, mental illness, mental well-being. And for us, that's not fluff, but for coaches who are looking through the lane of wins and losses, it feels like that. So when you can connect a concept like psychological safety back to the win-loss column, it really helps, and that resonated. But what I've seen is I've seen coaches who can do this well, and what they've done is they've completely changed the environment with which the team functions. They have a superior culture in terms of student athlete issues going down, higher GPAs, less substance abuse or misuse, and then ultimately, and it doesn't always, sometimes you just have a bad year, you have injuries, or you have things that you can't avoid, but it often can result in higher performance. What happens on the other side of that is student athletes start to see their coaches less as robots or bosses, and more as humans. And what that does is the coach understands me. I know that I can come to my coach if something's bothering me. I know that I can come to my coach and say, hey, I got no sleep last night. I feel totally stressed out. My sister is sick, and we just had to put down our dog, and I just can't take it. I need 30 minutes back, or I need, to have a minute to myself. And you've got a coach who isn't just going to say, okay, that's fine, sit on the sideline, but hey, let me get you some resources. Let me connect you with the right people. Have you talked to our athletic trainer yet? Have you talked to behavioral medicine? And try to be proactive in helping that student athlete, knowing that it's going to be not only the best for the student athlete, but the best to create an ongoing and sustainable culture of transparency and willingness to be open about whatever is going on. We use culture a lot here as a word. I know it can be overused, it can be misused, but I think in athletics, creating a team culture where you have that environment of safety and problem solving can have immediate outcomes. And so it's not, I think there's a stereotype, and I've used it not only on this webinar, but in other instances in my day-to-day, where sort of old school coaches get put in this box where they can't adapt to the new age athlete. I've also seen old school coaches be some of the best adapters and understand the reward of trying to meet student athletes where they are versus expect them to come into their program and do exactly, what's been prescribed for the last 35 years. So there's been more compromise on both sides. And I think both entities, both student athletes and coaches, are seeing positive outcomes from that. And so, that sort of seeps around a department. For us here, I see that there's 1, 2, 3, 4, 5, 6 coaches who are really doing this excellently. And you can see how much happier their student athletes are, how much more they're involved in student athlete organizations, or going to the 4.0 lunch, or whatever it is. And other teams want to adjust their behavior so they can align with that same thing. So can't talk about psychological safety enough, if and I think it's applicable to all levels. We're talking about college today, but it's something that I wish that we talked about more in high school and elementary and all those, just so that you're growing up in an environment where you have that trust and transparency and cohesion.
Yeah. And and you've highlighted the key role that coaches and staff have in building that psychological safety. And John, I want to get in a minute to you to hear about the peer piece, the teammates, the parents, how they can contribute to that, following what Linda said. And Caitlin, if you could just speak a minute or, a bit about how does a clinician kind of help to form this psychologically safe culture? Because we do know that help seeking can be tough when there's this idea that you shouldn't be struggling. So thoughts about that?
Sure, that's a very good question. And, I think that can be answered both from the lens of individual clinicians. So, Caitlin, am a psychologist working with individual student, but also on a higher level. So if you have, and I'll speak a little bit to that to start. So, Kate was talking about some of the systems that have been put in place where clinicians are actually really visibly involved in athletics. So that can be in a number of different ways, right? So some departments that have a fair amount of funding to be able to do this might have one or more clinicians who actually are specific to the athletic department. And that can be really important for a number of reasons. Just ease and simplicity is one, right? Like I'm at practice and then I go meet with this person, but also because it sends a message that this is needed in the athletics department. You know, we understand that you are a student athlete and there is a good chance that you might need mental health support. And as a result of that, we have this resource here for you. And especially if that person or those people can have a background or understanding of what it's like to be a student athlete. You know, I've heard a lot in my work, you know, once a student athlete, particularly someone who's very competitive, starts talking about feeling overwhelmed, and the clinician says, okay, well, did you think about quitting? Well, then, you know, they're not thinking about quitting their sport, even if, you know, maybe ultimately that might help them, help their mental health. This is part of their identity. They're not quitting their sport. So, you know, when a clinician starts to talk like that, it can send the message that they don't understand. They don't understand what it's like to be a student athlete. They don't understand the culture. And so it's so important that whatever clinicians are working with student athletes, that they do understand to the best of their ability. And ideally that will be through collaborating on campus with trainers, with teams and captains, with coaches, with the athletic director. And it might be that there's not the funding or logistics available for someone to be on campus, but maybe there's a connection with a group of clinicians in the community where there's some training back and forth. Maybe there's a connection with a company that provides online mental health services so that students can access mental health services from their dorm, or they can use an app on the bus when they're on their way to a game. You know, I think there's a lot of things that that clinicians can do. But ideally, one of the things is that they really do try to have an understanding of what it is like. And that's both because the department has, and the school has put some resources into that education, but also because it's, you know, it's a good fit and the clinician is making that effort as well.
Yeah. Thank you, Caitlin. John, and then we'll take some questions. We'll pause for some questions after. John, please.
Yeah, so Caitlin, well done. I mean, this concept of understanding is something that I just think is so vital in this. And when my son took his life, he lived in a home that he believed didn't understand him. And I think I live with that every day. I don't think he ever said, yeah, my dad gets me. Because I didn't. I loved him. I was there for him. And I was positive always, isn't this great? Isn't this wonderful? This is so cool. I wish I was you. Let's trade. This is so great. And I thought I was being so positive role model for him by being positive. But every positive word that I uttered to him showed him even more that I didn't understand. I was looking at his life I graduated from high school in 1980. I was looking at his life through 1980 eyes. And when I think of parents today, it's so easy to do that because that's what we know. But after he died and I formed this foundation, I started hanging out with these kids and I started to really see what they do every day and the challenges that they face and how difficult it is to get into any school these days. And you have to get straight A's and AP classes to get into a state school, let alone Ivy League school. Even if you do get straight A's, you're not getting into school because you know what? There's not enough spots because the world is small and it's more international, and et cetera, et cetera, et cetera. And I never thought of that. And I wouldn't have made my high school team growing up today. I played in the big leagues. I pitched for the Boston Red Sox. I would not make Northview High School's baseball team because when I was 10, I wouldn't have made the travel team because I developed late. And at 10, 11, 12, you pick your sport for life. I got to play 3 sports all the way till I was a senior in high school. And it's so different. And I never thought of that. I never tried to see the life through Will's eyes. And I challenge parents to do that, to stop looking at his life through your eyes or her life through your eyes. Try to see it through their eyes because it is different. And you know, Linda said some statistics earlier today where she's talking about 40 hours of this and 36 hours of this. right? Well, how many hours in a week, right? I mean, there's not enough time. And that concept of just one time, if I would have said to Will, wow, this is really hard. This sucks. I didn't have to do this. I would have shown him understanding. And maybe he would have said, thanks for that. What else is going on? I don't have the answer, dude, but talk to me. Maybe together we can figure it out. And I think that's kind of the message we're thinking about, even from the clinician standpoint that Kate was talking about, but also from the coaching standpoint that Kate was talking about. This concept of I get you. You still have to do it, but I want you to know that I understand that this is really hard. And the best way to maybe then make it a little bit more fun, because it's supposed to be fun, you play baseball. You don't work it. You don't stress it. You play football. You play lacrosse. I guess you don't play running. In fact, I stress running, Linda, sorry. But this concept of playing, it's supposed to be fun. So how's the most fun you have is with your teammates. So create that culture where the teammates are in this together, and they don't only share in the wins, they share in the losses, they share in the negatives, because they understand each other. So creating this culture where you're showing understanding goes a long way to creating a culture where an illness that is maskable can be talked about. Oh, I wish Will just would have talked about it just one time, right? And I think that's what's so important. And by the beauty of this is by doing this, you're creating a more fun place. You're creating a more fun team. I'll tell you what, if you want to be a varsity athlete, if you want to be a student athlete in college, you better love the game. If you don't love the game, you will not make it. You will not get up at 6 a.m. You will not do this. You will not go through this full-time job that Linda was talking about. So as a coach, what are you doing to help these kids love the game? And to me, the best way is utilize each other, utilize those teammates to deliver hope to each other, to make them love the game. I go back to my reunions every year. I never talk about one win, one loss. I talk about my teammates talk about the psycho coaches and the crazy bus rides and the locker room and all of these fun things. We don't remember the scores. We remember each other. So it's a great challenge, if you're creating this culture where these guys are building relationships with each other and improving relationships with each other, they will be there for each other on the field and off. And if they're with each other on the field, I think you're going to see some success as a result. And Ken, I'm really hoping that you're able to show this, over time, these coaches that are grasping it, they're going to say, you know what, there's a chemistry amongst this team that didn't exist before we started doing this mental wellness program. I think that's a great positive outcome that we could strive for, is build that chemistry where they can talk about it.
And I want to highlight a couple of things that you brought up, John, and thank you for sharing that part of your story. And that's that this is something that as parents, coaches, that one thing, I'm not a coach, so I'll say as a parent, we can share our failures. We can share where we've made mistakes. So it doesn't feel that we can try to at least understand that and get that. But the other piece I really want to highlight that you said is we can ask and we can be there for them, and we don't have to have the answers, because we often don't have the answers. So I think I can only imagine for coaches that must be a hard place to be in. The fear of asking and then what the answer might be, because there's not a fix for it. So I'm going to pause for some questions, Nick. I know you've been very kindly watching the Q&A. So anything you want to bring out as questions?
Yeah, for start, we have an attendee raising her hand. I'm going to open up for her to ask a question live.
Great. Hi, Samantha. Can she unmute, Nick?
I have requested.
Okay.
I can't force her to unmute though. We'll give her a moment, and while
sure,
that's happening,
perfect.
I'm gonna
That's
read
great.
another question. What do we offer to students about recognition of signs and symptoms, what to say or not to say, who to turn to for help, etc.?
Kate, yeah.
No, I'll probably defer to Caitlin on this. The one thing I'll just chime in, and maybe Caitlin, you can take more of the signs and symptoms for us, just from a best practice standpoint, is I would say we cannot give enough options on where to turn and who to go to, because what we've realized is there is such a range of level of comfort in types of individuals and what role they play on campus, whether it's a coach, assistant coach, athletic trainer, academic services support person, someone like me as an administrator, teammate, et cetera. So one of the things that we talk a lot about and have at America East and here at BU is the need to educate all those different constituency groups to ensure that they know the right referral and path, and the sort of, place that you go if you don't have the answer, and how to get that person the help that they need, and remind them that none of them are clinicians, at least some of the subsets of constituent groups I talked about, but that their role is to help that person get into the right place. And so we just try to do as much educationally as humanly possible to help them understand the signs and symptoms to be looking out for, and then what to do when they receive that information. But yeah, maybe Caitlin, you can talk a little bit more about this, or front half of that question.
Yeah, sure. And, I think this is a good time to discuss that there are a number of great programs out there that are evidence-based, that are meant specifically for college students. For example, there's the MindWise on Campus program, I know, helps to educate college students on signs of suicide, what to look out for, how to respond. So, one thing to keep in mind is just you don't have to start from scratch. There are things out there that you can utilize to help educate students or student athletes. And then, I think also there are some myths, and these programs would dispel some of these myths. For example, some people are worried that bringing up the question, are you thinking about suicide? Are you thinking about dying? Might convince someone or give someone the idea, but that myth has been dispelled. Talking about suicide will not cause someone to consider suicide. In fact, asking someone directly about suicide might make them more likely to be able and willing to talk about it with you. It might lower the risk that they might do something impulsive because they're sitting there and talking about it. Another thing that people might not realize is that a lot of people, in fact, most people who are considering suicide usually tell someone either explicitly or even more subtly. They kind of throw in some subtle signs, and sometimes people can respond and sometimes they might not. There are certain risk factors. For example, females are more likely to attempt suicide. Males are more likely to die by suicide. So, if there's a male, but suicide is unfortunately, a leading cause of death. So we all need to be aware of some of the warning signs. So as I just alluded to, so talking about suicide, making comments, writing about suicide, those can be warning signs. Changes, so like if someone's weight changes quickly, their hygiene has a significant change all of a sudden, or their performance changes drastically in a quick time frame, starting to lose interest in things that they formerly enjoyed doing, or having some big mood swings, making comments, not necessarily about suicide directly, but about how people would react if they weren't around, like talking about being a burden, that people wouldn't miss them if they weren't around anymore. Sleep changes, withdrawing, and then a common one is also starting to give things to people that they give kind of their important items away. So, giving away some jewelry, or giving away something that's important to them, giving it to other people. So, some people, again, this is high level. Some people who die by suicide or attempt suicide have not done these things, but many have. And so one way to talk to students and coaches and anyone really is helping them to understand some of these things, so that if they do notice something, they can either address it themselves, or if they don't feel comfortable or equipped to address it themselves, that they can then get some resources in place, get someone who might feel equipped and comfortable to talk about it. Because, if an intervention can happen, then you might be able to potentially change the course of what that person decides to do. So, but keeping in mind that no one, even clinicians, psychologists like myself, none of us have all of the answers in the exact ways to prevent this from happening. But I think it's important to let people know that they can work together with other people. If you're a student and a friend reaches out to you, you don't have to be alone in that. It might feel uncomfortable because you might feel like, okay, I'm breaking their trust. They're coming to me, but some things are more important than having someone feel like, you told someone else. If you really feel like you need to get someone's help, a professional's help, an adult's help, that in this situation, it's okay. And in fact, can be really important to do that, that you're not alone. The person who's dealing with the thoughts of suicide is not alone, but also the person who is being called on or perhaps is in a position to offer some support, that person's not alone either.
Great, that's a great point. And also, again, thinking about that system of care, and often building that strong pipeline between the coaches, or that communication between coaches and the clinical folks. When you were talking about the risk factors, I was thinking that sports are unique in that there's team practice every day or most days. So if someone stops showing up, if they're not giving it their all, I can imagine that would be a risk factor as well. I think there are a couple of other questions.
Yeah, I can read the next question.
Thanks.
Most kids' brains have not fully developed until they are 25. How does that affect the psychological care for athletes?
Who's going to tackle that one? I can start if anyone has anything to add. They certainly can. So, I think whether you're dealing with an athlete or a young adult who is not an athlete, it's, when we talk about the brain not being fully developed, typically what we're referencing is the frontal lobe of the brain that is responsible for things like judgment and decision making and impulse control, long-term planning. And so, student athletes are still, if they are of typical college age, likely not fully developed in that regard. So it's important to keep that in mind and to know that, something that might seem obvious to an adult with a fully formed brain might not seem so obvious to a college student, or that they might be really focused and engrossed in what is happening this week and this month. And, it might be hard for them to consider what it will be like in a year or 2 years, when they have graduated, when they're not playing their sport anymore. And so, I think really just keeping that in mind in your work with them, whether it's as a clinician or a coach, is important.
Nick.
There is another individual who wants to ask a question live. I'm going to enable that, and hopefully we'll have a little better luck. Lauren, you're free to ask your question if you'd like. You can unmute yourself. All right, I guess that's not gonna work. I think that's all the questions we have at the moment, but
Okay.
we will keep monitoring them.
I just wanted to mention in the chat, there were a couple of folks that talked about their own experience being a student athlete and having experienced a loss, and just really appreciating this conversation, and John, appreciating what you've shared. So just to kind of move into the second part of our conversation here, if we think about addressing suicide directly, now thinking about what can we do, how can we address this in a way that's preventative and that also provides an understanding? So John, you have talked about the link between mental health struggles and suicide, which I really, really appreciate. If you could talk a bit about what you've come to understand the role of family, what you're seeing perhaps with coaches, the changes that have happened around understanding, being more open to talk about suicide and suicide prevention, that would be great.
Yeah, sure. I think, I will say, what's been happening over the past 4 or 5 years in particular, even in the athletic world, is very encouraging with athletes coming out talking about their issues, whether it be depression or other form of mental illness that really, negatively has affected them. And I think it's really eye-opening. And by the way, it's not just athletes. You hear it in the music business all the time, right? And it's very powerful. And so I do feel like when I first started entering into this world, the concept of depression, that stigma was really, really strong. But we don't talk about it. And I would even have people call me worried about their son. And then the last thing they would say was, can you just keep this between you and me? And I wanted to say, well, if your son had another illness, would you say that to me? Right. And just be careful, because your son and your daughter sees you and hears you. So if you as a parent, as you as a coach, approach depression and mental well-being as something that is common and it is okay, and there are real ways to address it without losing your stature or losing your position. Losing your thing is very important, and in a very positive way, as opposed to like, oh, okay, mental, it has the word mental in front of it, I'm just going to leave it alone. And I think that's just so important to treat it more like an acceptable illness, right? Because these people don't want to have depression. They don't want to feel the way that they're feeling, but they do. The fact is that they do. And so I think the idea of shunning them or allowing the stigma to win is a very dangerous one. And it's a tough world. As I keep saying, it's tough for the coaches. I have empathy for them. It's a very difficult thing when their livelihood is dependent upon whether they win or lose, not whether they create fine young men or fine young women. And I'll say to these kids today, when you're 30, it's not going to bother you that you had to sit out a semester when you were 18, right? But when you're 18, it's going to bother you, right? And so it's just this concept of understanding and not having, as an adult, not having all of the answers. It's very hard for us to see our kids not okay. We want to make them okay by dinner because we know they will be, right? But I think this concept of showing the understanding and acknowledging, what do you guys say at MindWise? You act, right? You acknowledge, you care, and then you talk about it. You tell a trusted adult, all of the people that Caitlin was bringing up. I think that's just so key right now. Is we've said it 1,000 times here. Is just not being afraid to talk about it. It is okay. It is treatable. It is beatable. It is common. And it is okay. And I think that's really one of the tougher things to do when you're in a competitive world. And it's my daughter's in therapy, and I'm so proud of her. But 13 years ago, I probably wouldn't have said my daughter's in therapy.
Yeah.
Because I was just like everybody else. I was an old school guy. And so this makes it hard. And so I think that's when I do give the talks to parents, I keep saying, you're not listening to a psychiatrist or a psychologist, you're listening to a dad who misses his son. And I just wish I would have just said to him and asked him, wow, this is hard. Are you okay, dude? I didn't have to do this. So I'm not sure if I can help you, but let's talk about it. Something to that effect. There's no reason why a coach can't say that to a player.
And you mentioned stigma that's come up earlier. And I think we have this idea that stigma is decreasing around mental health. Curious to hear, Linda, for instance, from your perspective, what are your thoughts and what have you come across in terms of stigma around mental health, suicide risk, even therapy?
Well, I'm not in the collegiate athlete area. It never was, except when I ran. And I'm no longer at a school, but I can tell you that toward my last few years coaching, I was very conscious of the fact that a lot of kids were struggling, apparently. I mean, it was obvious. And they were also very open about it. There were no reservations about saying, hey, coach, I'm so anxious, or, I can't do this race. And, that presents its own challenges. And it was the little tidbit I was going to offer at the end, but I'll say it now, which is that, and Kate, you might be doing this. It sounds like you guys are where you're working, but at the high school level, certainly, you don't really know what to say to the kid who comes up to you and says, I'm really nervous. I don't think I'm going to be able to race on Saturday. And I mean, this happened, and I think coaches need tools to how to handle this, because it's great to have acceptance and all of that. I'm all for it, but at the same time, you don't want it to be something that well, I don't want to race and I'm a little nervous. You want to help them confront some of these things. That's your job as a coach, is to also help them develop and, like, look, this is going to help you. You're going to just help, it would be really helpful to have tools as a coach to know how to handle some of these things. So that, maybe I'm getting ahead of myself, but the point is, I saw tremendous openness among, and it was girls, and they are more apt to be open about not feeling great. They're also probably they're probably feeling worse than a lot of boys if the stats are accurate. So, I can't speak for college, but there was certainly a lot more willingness to talk about it at the high school level.
Absolutely. And I really appreciate what you said about coaches training, because if we're thinking about a systemic view of suicide prevention in a community, in athletics and departments, it's how do you provide the tools, the language to the student athletes? How do you provide, I want to say, the language and the understanding, but also a certain level of confidence with the coaches? For many, Kate, you pointed out the generational differences, and I so agree with what you said around, we can't assume that someone of one age is going to be more comfortable talking about this than a person of another age. And I think there's a lot of fear among coaches about recognizing that someone's depressed or anxious or has an eating disorder, because as one coach I remember said, our job is very visible. Everyone knows how we're doing because it's on Wednesday night or it's Saturday or it's at the game. So I think it's so complicated around those pieces. From a systemic viewpoint, Kate, I wonder if you could share what you've seen that has worked. I also want to mention, sorry, one more thing. In the chat, I saw a question, I think it was a counselor who said that they sometimes hear from student athletes about struggles, and the student athlete does not feel they can go to the coach. And how do we address that? So maybe that's a lead in, Kate.
Yeah, it's a really challenging area. One thing you said, Lisa, which I think is really important, and if we can make a baseline assumption, if we as either student athletes or administrators or advisors or sort of the supporting network, come in with the lens that I've observed, which is our coaches are so scared to make a mistake. They are living in an environment where a student athlete suicide is constantly on their hearts and minds, whether it's because it's happened when this last spring, there was, an unfortunate amount of collegiate student athlete suicides across the country, some very high profile institutions. And I remember after the Stanford student athlete, the soccer community, so it's not geographic. It's just that the soccer community felt this heaviness. And I think all of our coaches felt this concern that, that just this constant unease of, am I doing enough? Ruminating on, student athlete X came into my office. Did I give her the right resources? Did I not? Should I have followed up? And then, that's also met with HIPAA and FERPA and all of these, sort of barriers that are, put in place for the right reasons, but that a coach then feels like they don't have the information. And so they feel on both sides of it, they're pulled in this direction to make sure they're doing everything humanly possible. And the other side, there's a lot that they can't know. And what I get told from them is, I don't know if I'm doing exactly what I'm supposed to be doing, because I don't know how much I need to help. I don't know how much I need to intervene. And, in an ideal scenario, which doesn't always happen, is a student athlete is also communicating back to their coach. So the coach knows then to how adjust, whether that's adjusting how they're talking to them one-on-one, how they're addressing them in a team fashion, sort of where to give compromises and leniencies in different areas so that that student athlete can either reacclimate back into the team or, deal with the challenges that they're facing. And that's just a constant push and pull that our coaching cohorts are always sort of battling and struggling. One of the things I will say is in the last decade that I've been doing this work, when I think something that's a positive change is our student athletes aren't even looking for destigmatization, like work anymore. That it's not stigmatized among them, it's stigmatized among us. Like and that's a cool concept. It feels like sometimes, and I'm not that old, but I feel like I'm in a completely different generation, which I am, but of these student athletes where it's totally second nature for them to talk about going to therapy. In fact, the disconnect is between them and us in terms of, sort of more generational approaches to this. I think sometimes we actually tend to think, well, there's such a big stigma there, and there is a big stigma there, but not between them as a community of sort of young adults. And that's a really positive change, because to some of the things that John has talked about is peer-to-peer interaction then catapults them to get help, because they've seen now that the cool junior captain got help. And so the nervous freshman says, where'd you get help? How do I do it? And that sort of organic change has been really a positive thing that I've seen take place over the last decade in college athletics.
Almost like a mentoring within the team of the junior, senior to the younger. I just want to ask you this question to speak to, Kate, because Linda, when you were talking about kind of the changing landscape of athletics, it reminded me of the transfer portal. And for those of us that aren't so kind of in the athletics world, could you talk a little bit about how that impacts the student athlete experience and maybe even create stress and then another form of stress for coaches and student athletes?
Yeah, so the transfer landscape in college athletics has changed dramatically over the course of the past few years. And what that means for coaches is that when you used to recruit kids, you were recruiting kids to be there for 4 years. So you knew that when they committed to go play, at Northwestern or at Boston University or whatever it is, that you were going to develop that child, not that child, excuse me, thinking of my own children, you're going to develop that young adult, from the time that they were 18 to the time that they were 22, and you were going to watch them build. So you invested a lot of time and energy into doing that. And what happens now is we have student athletes, and there's a lot of different perspectives on this, and I won't share really any of that from at least how I look at the positives and negatives of transferring. But what's created from an environmental standpoint is that coaches don't have any consistency year over year in their roster. And so they're spending time investing in kids, and then all of a sudden they turn around and they leave the next year, whether that's for financial reasons, or maybe they just were struggling, it wasn't the right academic fit. And so that's caused an exorbitant amount of stress for our coaches, in that they don't know from year to year what type of team they're going to have. I sat with our Feel Lucky coach just yesterday, and we were talking about 25, 26 student athletes. So these are sophomores in high school. She's already focusing on that. She's thinking about, who she wants to bring in for that class. She's thinking, hey, I need a goalkeeper here because I'm going to be graduating one here. And the next thing you know, the goalkeeper that she thought she could rely on, that she'd been grooming, is gone. And so there's just this uneasiness that the transfer portal has created on the coaching side. And then, on the student athlete side, I think it's just you're having to change yet again. And so the sort of adapting into a new model and all of the things that go along with just sort of changing the environment that you're in has created some additional issues and challenges for student athletes. But for the most part, student athletes have a positive reaction to the ability to transfer where they want and go where they want without penalty. It's really the coaching side that has an issue with the transfer landscape.
Great. Anything else that anyone wants to add in that piece before we move on?
Could I add something?
Yes.
I think one dimension of this we haven't spoken about is, in talking about mental illness and depression and anxiety, it's also really, I think, important to remember that athletics are inherently emotional. And, you know, we're talking about the teenage brain and how it's not fully cooked and they can't think about the future well, and they're very emotional, and that somehow we have to be able to distinguish between a real mental health emergency. And I don't, not maybe necessarily we as coaches, but I think it's important that kids don't get the message that "Oh, you're sad, you have a problem." It's like, no, everyone gets sad, everyone gets worried. This is normal life, and it's not a big deal. And it's part of sports, in fact. It's like, that's one reason why we play sports, so that we can learn to handle these things. And I don't know, I'm just very conscious of the fact that certainly when I was a coach, that I didn't, in talking about their well-being, I didn't want to make it seem like, "Oop, what's wrong? You know,
Yeah.
you're not happy. That's fine. You shouldn't be happy all the time." And I don't know
That's right.
exactly how that fits in, but it's something that I think coaches have to grapple with. And it has to do with finding, getting the right tools to know the difference between ordinary sadness, tears about a loss, and like something's going on here.
Oh, that is thank you for making that point, Linda, because it's so much on a continuum, right? We all have stress at times. We all feel a variety of emotions at times, good day, bad day. So I think what you're raising is, again, getting back to kind of those risk markers. When do folks in that athletic system, coaches, trainers, parents, friends, when do they recognize that something is out of the norm and moved into kind of that risk category? So incredibly important point, because if it becomes everything is, I think part of what you're saying, Linda, is that if it becomes that every time a person is sad or anxious or nervous, there's this big response, it could actually reduce the chances that somebody wants to come forward. So that normalizing piece is big.
I think what I like about this whole concept, though, guys, is that, you know, all of the things that we're talking about here, that we're suggesting that coaches could consider doing, it's a positive impact on every single one of their players, not just those that are struggling or those that are suicidal or those that are sad. It's, you know, we're talking about creating this culture where it's more open, it's more empathetic, there's more communication, and it's a positive thing. And, you know, I'm at a point now where, you know, my goal is not to reduce the amount of suicides. My goal is to improve the will to live. And when I speak to 1,200 high school students, the vast majority of them are not suicidal, but they're all struggling. They all have a story. They all have an issue. And so if I can get them to, you know, feel more open about it and express a little bit more and be receptive to friends that do express, the relationships are going to improve. And that's a great thing. And maybe high school will be a little bit more fun, like it was when I was in high school, right? And so I think this is something for coaches to understand. What we're talking about is not just going to help those that are really struggling. It's going to help everybody. It creates this positive chemistry, which is a really good thing, because it's, you know, Linda's absolutely right. It's you know, it's a very difficult, you know, what I haven't answered in this little speech is, how do you determine when someone is, you know, crossed the line, if you will, and become a real risk factor? And that's what makes it very hard. But at the same time, everybody can benefit from this positive, you know, this empathetic approach.
And that's when there's that strong link, Caitlin, right, to counseling between the coach seeing the risk factors. And go ahead, Caitlin, sorry.
Oh, no, that's okay. And, you know, I was going to add to both Linda's and John's points. Linda, I totally agree that, you know, the pathologizing of typical emotions also doesn't help anybody, because then it, to your point, sends the message that, okay, we can't handle all these emotions. We have to pass you on right away to counseling, right? And so there's some nuance there in figuring out how to discuss that. And it also can inhibit, you know, someone's own coping skills. If they think, okay, that I feel anxious, I must fix this. Not like, I feel anxious and I feel anxious because I have a big game coming up and this is very important to me. And that anxiety is not a bad thing. It's a sign that something is important to me and that I'm going to put everything I have into it. So, you know, I think that's very important. And then to John's point about, you know, it helps everybody, not just the people who are suffering. Well, the people who are not suffering today might be the people who are suffering next year. And so when those messages are ingrained and it's part of the culture, then it's not just a, you know, kind of whack-a-mole of like, okay, who do we need to help today? It's, whatever you're dealing with, we'll be here for you. Whether it's you want to just talk through, you're feeling anxious, you're feeling sad that you lost, you want to talk through that, or there are some signs that you might be dealing with the clinical depression, or there's some signs that you have an anxiety disorder. Whatever it is, there's support for you from the regular supportive mentoring conversations to the clinical interventions.
Thank you. Thank you, Caitlin. So the final piece before final couple of pieces. So John, you mentioned the increasing the will to live and another way of thinking about reducing suicide, but more focusing on the hopefulness and the joy of living. And so our suicidologists at MindWise will often routinely say that we cannot stop all suicides. We cannot eliminate suicides, unfortunately. All we can do is hope to reduce death by suicide. So we know that the reality is that there will be those that die by suicide. And so a big part of what we can do as a community, as part of the community, is to then think about what's the postvention. How do we respond to that in a responsible, healing manner, and in a way that promotes healing, that and also prevents other folks that are at risk from dying by suicide. So I wonder, John, if you could just take a couple minutes to talk about the impact of that loss and how if you were going to share a bit of what you've learned. And tip seems like such a pithy word, but
no,
just kind of share a little bit about kind of what helped you and what might be helpful to others when there's a loss in the community.
Yeah, well, I guess the key to me, when it happened to my family, obviously we were uneducated, we were unaware, and so we thought Will had a character flaw. We thought it was our fault. We thought we did something wrong. All of this, and we were just so stunned. And getting a better understanding of mental illness and what it can do and how difficult it is, and Will didn't show any of those signs, right? Because he was strong enough and he was able to mask it, which some are able to do, and things like that. But understanding that it wasn't, it was a result of an illness, it wasn't a result of a character flaw, helped me a bit. But what really helped me was talking about it. And what was interesting is people were afraid to talk to me. My friends didn't know what to say, right? That his son took his life. I don't know what to say. And it was like, you don't have to say anything, just be there, listen to me, right? And so I would talk and they would just listen. And the ones that were most effective didn't try to have an answer for me. They just listened and then told me that they loved me and gave me a hug, right? And they didn't try to say, oh, give it some time, you'll be fine. Well, time doesn't heal anything. It doesn't, but love does. And so surrounding myself with loved ones, surrounding myself with people who knew Will, like his friends, I invited them over all the time, and I'd ask them to tell me stories, and they would, all of that. So we would talk about him just like you would someone who died from I can't say these things, a more traditional or more this illness of this mental illness stigma that exists in our adult world. And I think, Kate, you're right. I think the kids get it. The adults don't, right? And so getting them, people, don't be afraid to talk to the family about it. I think that's really important. And what happens when you do that, it makes it normal. It makes it okay. It makes it, and it just sends this message to the community that it's okay to talk about it. So my wife and I made the decision, we're not only going to talk about it, we're going to talk about it loud. People are going to know everything about it, because I had so many friends come up to me and say, yeah, that happened to my roommate in college. That happened to my uncle, or it happened to my sister. And I'm like, I've known you for 10 years and your sister took her life and you didn't, we don't talk about it. Right. And so it's that stuff. Just don't be afraid to talk about it. And I think that's what's really important. And I surrounded myself with loved ones as best as I could. But I think that's really an important part of it. And don't be afraid just don't sweep it under the rug. That's just the worst thing you can do.
Thank you.
I don't know if that answers your question, but there's nothing you can say that's going to make me feel better. Nothing.
Yeah, right.
Not one thing. No matter, I don't care how religious you are. I don't care. It's just nothing you're going to say is going to make me feel better. Listen to me, tell me that you love me, or just nod.
And just being there and simply being there. I think that was such a powerful point, John. So thank you for that. And a reminder that the connectedness is part of prevention and it's part of healing is what you're saying.
What was, it was really interesting. I would tell the kids, his friends, that I didn't know because they were looking at me like, how could this happen, Mr. Trout? How could this happen? It's like, I don't know, guys. I don't know. I'm with you. And you could almost see some relief there, right? I didn't have the answer. I was clueless just like they were. And so that was that, that understanding of each other, of how we're thinking and how we're feeling.
Yeah.
And we got them to express. They got me to express. And that really helped, in dealing with the grieving, if you will.
Thank you. Thank you for that. So final question for all of you, and then we'll go back to the Q&A and see if folks have questions, is what we've been talking about today, suicide prevention, supporting mental health, particularly suicide prevention, can feel so daunting, which it is. I mean, it's huge. So if there was, I think for many of us, it's what's from your vantage point in athletics and your connection to athletics and what you know in your area of expertise, what is one piece of kind of tactical, Kate, that was your word when we were talking about this. I love that. What's one kind of go and do that could be something small that folks could start with?
I can start. I sort of shared my other tactical point, but I think I think so much of this is on coaches. They are the ones who establish the team culture and who set the tone. And that if you're a coach, get educated. There's a lot of things you can learn. You can go online, first aid, mental health. I mean, I'm sure at places like BU, they provide a lot of this, but there's a lot of coaches who have no training whatsoever to, get a little education in it because it's not going away.
Thank you, Linda.
I'm happy to jump in too.
Yeah.
To piggyback a little bit on what Linda just said is start with a communication plan. And some of that is not necessarily postvention or in the crisis emergency action plan type, but for us here and many of the schools and universities that I've worked with is you start like we call it a care team, right? So communication and information sharing to the extent that information can be shared and HIPAA protected information aside. But if there's a student athlete that an academic advisor sees and is concerned about, then talk to someone else about that student athlete. Say to the athletic trainer, hey, you're going to see her today at 4:30, go check on her. So we have this sort of care team approach here. And that has been key for us in terms of just trying, we've got almost 600 student athletes, and through America East, many of our institutions were similar to that size. You're not seeing every single one of those student athletes on a daily basis. So start by creating some sort of communication system through your department, within your school, within your team, whatever it is, to try to just figure out a semi-regular way for, if it's 1, 2, 3 other people that you're connecting with, to just say the names aloud. Hey, here's who I'm concerned about. Hey, this person came up on our radar. Hey, this person lost their brother in a car accident. Let's make sure we're giving, him additional resources. Hey, they just failed a huge test. They're going to have to withdraw from the course. Let's make sure we're talking to her about additional resources. So I think this sort of systems approach and having a care team and communicating through that is something that you can start as early as next week. I always say it doesn't have to be the most baked out, laid out plan or committee or whatever. Just start having those kind of structures, so that you can provide as best sort of full baked out care as possible.
Yeah, I like that. The concept of make it an agenda item on your weekly meeting. It can be a 1-minute agenda. It can be an hour agenda, but have an agenda item so you always remind each other, okay, how are we doing? Any go around the table, whatever it might be. So they're just kind of talking about it. I think that's a great way to just make sure that whatever they're hearing they can start to address it now.
Well, and can I just jump back onto that,
please.
John? I think what you just said
course.
is so important. Is like, I'm talking about it in athletics setting, but I love what you just said. It's also like, and I bring this home and do it with my family. It's like an agenda item on nightly dinner, right? Like, how's everyone doing? Or in team meetings, or with your friend. It's just making sure that someone is asking those questions so that no one's slipping through the cracks. So I like your application on the other side of it.
and for the clinicians on this call to do that with each other when you're at work. Caitlin.
Sure. So, we've spoken about this in different contexts, but the idea of social connectedness, that social connectedness is a protective factor against depression, right? So this can be in whatever way teams and departments can foster this, it can be a really powerful intervention. So it can be little things like, check-ins with each individual student athlete that don't have anything to do with how things are going in the actual sport. It can be, and I'm getting a little more lighthearted here, but you talked about everyone being around, the day after Christmas, the campus is dark, maybe there's a little bit of funding and everyone goes bowling or goes to the escape room or, does something together. Again, nothing to do with the sport, nothing to do with school, not necessarily adding to the burden and the exhaustion, but little things that can be done to foster that social connectedness as a team, but also as a group of the whole athletic department as a whole. Knowing that they're student athletes, they do spend a lot of time with their team, but it's very focused time. And so giving them a chance to connect socially in other ways with people on their team, with their coaches, with people on other teams can be really important. And also just, again, noticing when maybe that's not happening, noticing when someone seems to be withdrawing socially, noticing on the bus ride, is there if there's a conversation happening, is there a student who's never participating in the conversation, and then giving some extra care and attention to that student. Maybe the student's best friends with their roommates and everything's totally great, or maybe they don't feel like they have a place on campus yet. They don't have those social connections, right, and they're trying to figure it out. So in terms of just prevention standpoint, but also an intervention standpoint, not forgetting the importance of that and not just assuming, oh, they're in college, they have friends, they're having a great time, because that's not necessarily always the case.
I think sometimes I wonder, where's the athletic director, right? All of these coaches report into the athletic director. So, creating that team among the coaches who best understands what it's like to be a coach today than another coach, right? It's the same concept as we talk about players.
Yeah.
And it just gives this concept. I mean, this meeting's going to end, and I have a marketing team meeting, and then I have a sales team meeting, then I have a customer team meeting, and then I have an executive team meeting. Then I got to go to dinner with one of our key customers in town and his team. These kids know more about what it's like to be a true teammate, yeah, than all of those kids who don't play sports. It is a massive advantage if they let it. And I think coaches, this concept, and I know it's corny, great teams win, but good teams love each other and all that stuff. We're talking about teammates a lot here today. Yeah. But it's such a great thing, not just for the mental wellness. It's going to create better people in society. And I hope when these kids are applying for a job and they ask what do they like most about themselves, I hope their answer is, I am a great teammate, and I love that about them, because they're going to need it in this world. And I just think, so it's, I'm trying to motivate the coaches to keep pushing that atmosphere, exactly what Caitlin just said, have the escape room or the bowling night or the team building activities, because life is hard right now for these kids, and these teammates can help each other through it. And it's going to help them in the long run. They have an advantage because they've been on competitive teams where it's exaggerated. The highs are exaggerated and the lows are exaggerated.
Yeah, and it's a great reframing to think about how we're all part of teams in our world. Yeah. So thank you all for that. And I think we have a few minutes and there are several questions, I think, in the chat. Nick, if you want to.
Yes, we have a bunch of great questions. It's going to dive right in. This one, Lisa, might be for you. Does SOS plan to offer an evidence-based training for the college population or even subpopulation of college athletes? If not, do you have some suggestions for trainings to be implemented on campus?
I see Kate smiling over there. So SOS, the answer is we've been developing a variety of resources. One is thinking about how MindWise on campus can be available for student athletes. And it's an incredible opportunity. Coaches have been very excited about it. Definitely something happy to talk about with anyone offline if there's interest. The other piece of what we think is really important, connected to Mindwise on Campus, which is our SOS peer-based suicide prevention program for youth, that now adapted for college ages. Also, how to not only provide education, which has been really called out, and Linda, you very importantly called it out as kind of your go and do, giving that information to giving mental health literacy and so forth to coaches, but also providing peer support, providing support for coaches, because we're putting even more on their plate. So I think it's also important, we know from the NCAA wellbeing study that coaches themselves are struggling and burnout is a huge risk. So how do we provide that support? So I hope that answered the question sufficiently.
Thank you, Lisa. All right, the next question is, let's see here, such an incredible panel. Kate, this was a conversation that came up with America East. And John, per your reference to your phone earlier, I'm curious to learn more about how schools are addressing student distractibility. For example, phones, social media, 24/7 news cycle, etc.
I don't have a great answer to that question.
I
and
know that's a
I-
great, that's a
Hopefully
great
that's
question.
yeah, good, a good question by the guys. I mean, we do, I think where we struggle is that so much of what like even, you know, communication apps that we use with teams, it's all on their phone. And so this sort of this, there's a real conflict in asking student athletes to unplug from their phone or put their phone down or whatever, when the primary methodology that we use to connect with them with everything, whether it's emails or teamworks or text messages or groups and all this is all through their phone. We also, I mentioned this earlier, we have a partnership here with Whoop. And we spend a lot of time thinking about sleep data and all these things. That's an app on your phone. It's really tough. I think, you know, when student athletes are, when it comes up that a key piece of this is they feel like, yeah, either the 24-hour news cycle, they're spending too much time, you know, on social media. Obviously, we've got people that we sort of encourage them to talk to and try to help with some of those behaviors or habits that they either are sort of feeling addicted to their phone. But I would say there is not there's not a real good solution that we have here, at least that I'm aware of, in terms of how to address this phone addiction, sort of screen addiction. With the exception of just encouraging student athletes to unplug when they need to, but I know that's certainly not enough. So it's a great question, and thanks to whoever asked it, because it's something for me to think about.
I think this is where there's no, I haven't heard a good answer in the 13 years I've been asked it or been asking it. But being aware, just being aware of the fact that they wake up today knowing that if they make a mistake, everyone they've ever known will know about it by dinner because of social media.
Yeah.
And especially as a student athlete, if they fumble, if they trip and fall, if they, whatever it might be, it's a whole, you know, back in my day when I was giving up massive home runs, only the 300 people in the stands booed me. Right. But today it would be everybody I've ever known. But just being aware, right? Again, the coach, I understand the challenges and the problems goes a long way. That's that understanding part. Right? Do you leave the phone? Leave the phone at the door. All phones on the kitchen table at 8 p.m. And then the rest of the night, they're stressing out because what am I missing? What am I missing? What am I missing? Okay, you can have your phone. And then at 2 in the morning, they're texting. It's just, can't win.
Yeah.
It's really difficult.
Thank you, Jeff.
And it's not going to go away.
Nick, I noticed there were a couple questions about material that could be provided regarding risk factors. So just to tackle that question, we can send information on the follow-up email.
Great, thank you. And the next other question, given the possibility of suicide clusters, if there is a suicide within the student athlete community on a campus, what would you recommend is done for the student athletes team and broader athletic department school to reduce the risk of further loss?
So I would jump in, and then Caitlin, I'll turn it over to you in just emphasizing the need and the importance for timely postvention, which is an organized approach. It's led by folks that have expertise in postvention, to provide information, to walk that very delicate line between not glorifying the loss and yet providing support, honoring the loss. And openly talking about it with the community, with the team. It can be very complicated and very nuanced. And again, a big value of it is not only to promote healing, but to prevent suicides among others that are at risk. Caitlin?
Yeah, thank you for that, Lisa. That makes a lot of sense. And, you know, there are just so many factors. And so to reiterate, it's very important to really try to bring in some expert help, because it is a very specific situation, and it can obviously have dire consequences. But, you know, everything from the way that student journalists are reporting about it to, you know, sometimes families don't want information to be shared, and that can be complicated. But ultimately,
Right.
you know, I think it's very important that when a suicide happens on campus, that every student on campus knows where they can turn for support should they need support in the coming days, that they know that there's resources available to them. I think that's of utmost importance in those situations.
Right,
Yeah.
excellent. Just a couple more questions. Linda spoke about the need for coaches to know how to manage student anxiety. This probably highlights the need to have people trained in sports psychology available. Is that something you're starting to see on campuses or at high schools?
Great question.
Well, I can say, I think there's historically, coaches have been taught about sports psychology in terms of how to get kids motivated and to stay calm during a big game or something, to visualize and relax. But the type of training, to the extent that they get any, is really about performance, not about you know, spotting a problem. So I think it has really not been much at all in the way, this is like a shift in the kind of education that coaches need. It's like in a totally different direction. It's not about getting optimal performance. It's about identifying potential problems, and really coaches neither, I can't speak to college, but certainly not at the high school level. There's none of that.
I can speak that a little bit here. The system that we have at BU, I think, is actually quite unique and really something that we've just tapped into university resources, but we have a sports psychology master and doctoral program here. So what we've done is just 2 years ago, partnered with our sports psychology program to bring sports psychology and sort of mental performance preparation to our teams. So teams can opt in, and they'll have either group sessions where they meet with sports psychologists to talk about performance anxiety, getting ready for games, just sort of staying into that. And then they can also meet individually. We try really hard, because I think even for that demographic, it can be really confusing between a talk therapist and a licensed clinician and counselor versus sports psychology. Is that's not behavioral med, that's not behavioral health. This person is specific to your performance. And if you have an issue, and the sports psychologists that work with our teams are trained to understand what an issue might be and make a referral over to behavioral med, just so that distinction is really crystal clear. This is about performance, and this is about sort of health and well-being.
That is incredibly impressive. Thanks that you has made that connection. Thank you, Kate. So Nick, I think we are at the end here of our time. Thank you, everyone. Thank you all for being here. Cannot tell you how much I appreciate the work you do and who you are, and this conversation today. And a reminder to folks that are tuned in here that our next learning session, MindWise learning session, will be March 6th, and hope that you can all join us. Take care. Have a great day.
Thank you.
Yeah.
Thanks, everybody.
Thanks.